guys, I'm gonna show you how to do a newborn assessment. I'm gonna try to follow from the head to the toe, but make sure I'll just gather everything I need for my assessment. I'm gonna introduce myself to Mama. Hey Mama, I'm here to do care, doing assessment on the baby, and because she has her own group of nurses that are do assessment on her, baby has his own team as well. And we're gonna have a baby boy for this example. And one of the first things we're gonna check is vital signs. We're not gonna check the blood pressure unless we really need to. But right now, we're just gonna check the heart rate, rest, and temp. So baby, we're gonna check his heart rate. We're gonna check it on the fourth intercostal. And we're gonna check for a full minute. And we're gonna use the bell, or we'll use the baby stethoscope meant for the babies. And while we're assessing baby, his full minute, we're gonna check that it ranges from 110 to 160. That's the normal. We don't want anything below or anything above. Alright, and now once with a complete minute, we're going to check baby's rest, about rise and fall. Usually if a baby goes through the transvaginal canal way, they get all the amniotic fluid out, so they breathe pretty normal. But sometimes if we have a C-section baby, they have like wet sounds, so we gotta make sure that baby chest rise and fall evenly. And we're going to check for 1 full minute because this is very important. So we'll check for 1 full minute. Alright, during that first minute, I checked if it was symmetrical bilat, and also like chest looks normal. I'm also assessing their skin. I want to make sure the rests are between 30 rest through 60 rest. And if it's anything more, like more than 60, is probably because baby's trying to compensate a little bit, trying to breathe faster to get some fluid off. That's also like more if your baby was at risk during like the pregnancy or during like the birth, labor. And now we're gonna check their temp, and we're gonna check it axillary, and it should be around like 97 to 99. All right, baby's normal, and we're gonna check vowel sounds, and we're gonna do it in a clockwise position. We want to make sure that they're not absent or hyperactive, because that could also let us know that there's an obstruction. So let me take this off. And while we're here, we're going to check the umbilical cord, and we're going to assess the cord for the 3 veins that we can count them and see that they're there. Now we're gonna go try to step on something. All right, now we're going back to the head. We're gonna try to cover baby up because in this new world, it's very cold and baby needs to stay warm. Now we're gonna check the head. Take this little cap out. And this is gonna be like the molded area because it's the soft part with soft nails. And it's gonna be misshaped, but it should go back between 3 days to a week. And we'll let mama know that that's normal. And we're gonna check the hard part. So that's symmetrical. We're gonna also see the eyes. They open and close, and if they're symmetrical to the ears. So I would dim the lights. It's far away. I don't know where the lights are at, but so we're gonna assess baby's eyes. And then babies are usually nose breathers, so I want to make sure if I cover one that baby's still breathing. And then I'm gonna check the other one because they're nose breathers. And now, of course, I still got my gloves on. I'm gonna check the sucking reflex, and also if baby's trying to suck my finger. That's normal because that's what they're supposed to do to a nipple to get milk. That would be a normal. They should have that reflex. And also, while I'm assessing baby's neck, they should be able to move. They should be able to also like hold their head just a little bit, enough strength. They do have a weak neck, so we have to let mama know. I'm gonna like stroke or like caress their cheek, and they should try to like nudge themselves to the finger. All right, and I'm gonna check their face for symmetry, full, normal. I'm gonna check their skin. Now that we're moving down to the neck. And I already told you about the neck. And we're gonna look at their now we're moving down to the chest. We're gonna look at extremities. That the baby, the skin is gonna look a little bit bluish around like the fingers and the legs, but that's normal because baby's trying to well, like homeostasis, get comfortable, the coldness. So most of their blood accumulates in their chest, but that's normal because that would regular out. But their trunk is usually more pinkish compared to the extremities, but that's normal. Nothing to worry about. And so we're gonna check for, well, we're gonna count their fingers. And baby has 5 over here. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So there's 10 fingers. And now we're gonna move on to the feet. Count their toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. They have 10 toes. And we're gonna check for the plantar and the Palmer's reflex. So we're gonna get our finger, and baby's gonna try to grasp it. Make sure that's good. Good neurological signs. And since I'm already at the feet, I'm gonna check the length of their legs, make sure they're straight, not one looks smaller than the other. And I'm gonna do the Babinski. So I'm gonna get like maybe like a little toothpick, my finger, and the baby should fan out. That's a positive sign. We want that, and if it doesn't, we'll do further assessment. And let's see, one of the last assessments, we're almost done. We're gonna check their genitals. So for the males, they're gonna have soft glands or smooth glands, and it's gonna be the meatus gonna be at the center. And then the females, they're gonna genitals are gonna be more swollen because of the mother. The estrogen levels also affects them. And now we're gonna turn baby over. We're gonna be careful, and we're gonna assess baby's spine. We'll make sure the spine looks normal, curvature that is symmetrical. We're gonna lay baby down, and trying to think, am I missing anything? No. We're gonna wrap baby back up, let mama know we're done with assessment, that we'll return later to check on him. And that's it, guys. Thank you.